Okay, now we're going to close up by, we have told our panelists that we would give them 2 minutes to each to address one or all of the following. What about COVID keeps you awake at night? What are the lessons for society and the healthcare system when hopefully the pandemic has passed? And if you had the power, what is the one thing you would change? And I would like to start at this end with Nick and just go that way and finish with Kirill.
Okay. So I thought a lot about this one, and I've got to be a little careful with my words, but what keeps me up at night at the moment is members of a hardcore sort of activist group of our profession who are fitting the vaccine data into their own narrative about which vaccine is better or worse, and potentially that having a negative influence on healthcare worker vaccine uptake or community vaccine uptake in Australia. I don't know how to deal with that, except for being as honest and transparent as we possibly can, but that is what's keeping me up at night. What can we learn from COVID? I think it's about, in a hospital health system setting, we can't, not everything will have the priority of COVID ever again, but we do need to create coalitions, shared sense of either vulnerability or action, and particularly from a sepsis point of view, that's going to be good and an important thing to do. And what could I change? Probably the Constitution. I'm not sure that Federation's done us any favours. I think I'm going to get in trouble for that.
But, well, that's interesting.
No, you're not allowed.
I'm not allowed to join in, am I?
No.
That's
Sure,
well done,
go on,
Nick.
jump
That's
in.
under your 2 minutes. Okay, Vera?
If I'm completely honest, I'm kept up at night about when I can travel and see family, new members of family I've never met, ailing relatives, and that really does worry me. But I think that's emblematic of the massive task ahead of the end game with COVID. What are we going to do as an international community until we can normalize our lives again in a very sensible health and economic way? What are we going to learn? I think we still have yet to find out what we're going to learn. But I think the vital thing is that we have a scientific dissection of the learning points from what cultures and governments and political systems have been advantageous, what can others do, and also all the medical stuff as well, vaccines, mRNA technology, and so on. If the one thing I could change, I would revitalize, resuscitate the World Health Organization. I think she is a jewel in our public health crown that we lose the shine of, is a terrible thing to do. It's very, very sad, and I think we need to think very long and hard about that.
Thanks. Carrie?
Thanks, Simon. What keeps me awake at night is similar to Vera, because it's quite personal for me, which is that, when you haven't seen your grandchildren personally for 18 months, it's something that affects us all. And we've all got our own personal story about that. And I think that is what makes it real and relevant to us all. I think in terms of what we've learned, I think there's so many things that we've learned in the last 12 plus months that we should not forget on and we should protect. It's the acceleration of how we've learned, we've implemented at scale, we've innovated. We can't lose that. It's that sense of equity, which we've spoken about. For me, it's also people's focus on standardization, evidence base, information and knowledge, and how do we get that to people. But what people talk to me most about is what they say is that what's hit people the most is our need to focus on well-being and the psychological safety of our staff and the people that we work with and connect with every day. And that, for me, the one thing that should change, if we're going to really think about prioritising it, is listening to what our communities clinically are saying to us, that we need to start putting that at the heart of everything we do and be transparent and empathic and much more focused on how people feel delivering care, not just how they deliver care.
So question one, there's going to be a lot of traumatised healthcare workers globally after this. And that's one of the things that concerns me, how we help people process that trauma. I'm also, hoping and concerned that we'll have a good vaccine rollout. There will be hiccups along the way, but I hope that it goes well overall. What we've learned, I want the next pandemic to have behavioural science advice at the centre of government advice. It didn't happen with this one, and we were calling for it in 2009. I want to see that happen with the next pandemic, because there's so much we know about human behaviour, about good communication, including crisis communication, that we can share with governments and people working with governments. And finally, I hope that we include nurses more in the planning around the vaccine program than we're doing now. They are the ones who usually deliver vaccines in the community, even if it's through general practice. And yet there's a little bit of a blind spot there in the federal planning right now, and I hope that will be fixed. That's it.
I think for me, similarly to Vera and Carrie, I think what keeps me up at night is figuring out when I'll see my family again. Most of them are overseas. I think that's a sentiment a lot of us share. In terms of lessons I learned, this is probably a bit of a tangent, but I remember when I was in Yemen, feeling completely helpless about the situation and just taking it, not questioning why the situation was so, and just feeling like it was just the way it is, and I couldn't question it. And I think that was part of the difficulties I faced after the mission ended. And I remember telling myself before my deployment to Iraq that I was going to do something different. And that thing was to stand up and fight, because I think, especially as a junior doctor, going through your training in the places that we go through, sometimes we just accept things as is. It's so easy for us to just bend over and take it, to say that crudely. And you don't have to. Like, I realized that in the end, you have power. You have so much power to stand up for what is right. And if there are things that are happening at the moment that you're seeing that is unjust and that people are suffering as a result of, you have a responsibility and you have the power to actually stand up and fight against it. And that made my experience in Iraq significantly better in the end, because with government officials, ministers, I just didn't care. Like, I just stood up for what I believed in to be right for my patients, for the people that I worked with. And interestingly, it created a really positive outcome in the end. And so I just want to empower, especially the doctors and the trainees that are around or who might be listening, fight for the system that you believe in, fight for a better future. We're all in this together. Like, I really, truly believe that, and we have to help those in need. So we have many, many seconds on this earth, and I feel like every second is a chance for us to make it a better place. So.
Thank you. We have to wrap up now, unfortunately. Just want to thank the panel for all your inspirational and thought-provoking comments, and of course to Prof. Finfa for leading the discussion there. It's truly wonderful. And we'd like to, we're proud to collaborate with MSD, who is sponsoring this educational event. And MSD is committed to combating infectious diseases, the rise of antimicrobial resistance, and to developing effective responses to the current pandemic. So thank you.